I think that both of these disciplines would work better together because they both deal with local tumor treatment, but in different ways. Radiation oncology uses irradiation, of course. Interventional oncology uses invasive, minimally invasive techniques, but they both aim to do the same thing, which is to destroy malignant tumors. And I think working together, they can expand the spectrum of what they do.
Increasingly, there's going to be a focus on local tumour treatment, and both radiation oncology and all of the interventional oncology techniques in the main are focused very much on that. And by really refocusing the world's thinking on local treatments, I think that naturally that actually brings radiation oncology, interventional oncology, and other minimally invasive surgeries closer together. Radiation oncology has a very long, very proud history with an enormous amount of data, research and evidence behind it. It also has had a very significant focus on quality assurance and quality control. Interventional oncology is a much younger specialty. And originally, we were the one person, and radiology and radiation oncology diverged in the 1960s. And so now, with radiation oncology having such wherewithal behind it, and as a natural partner, interventional oncology has a lot to gain, but radiation oncology likewise has an enormous amount to gain. And they're really two sides of the one coin. And so by bringing these disciplines together, what that really does, it enhances both disciplines and both specialties, and that opens up a wealth of possibilities for patients in terms of treatments. And at the end of the day, that's the heart and the soul of the partnership.
And from the interventional oncology point of view, there are practical logistic gains from collaborating with radiation oncology, because radiation oncology is an established clinical discipline with access to patients, they're used to outpatient clinics, they're used to all the aspects of clinical care that are taken for granted by all clinical disciplines in the hospital, whereas interventional oncology in many places just hasn't got access to that infrastructure. So being able to work together with radiation oncology colleagues, we would actually gain access to real estate, to nurses, to radiographers that are used to working in a clinical environment. So there are potential immediate practical gains, as well as the ones that Liz described in terms of the long experience of radiation oncology, the established methods of research, and the established methods of education.
There is no competition here. Overt collaboration is really what we're looking for, so that when somebody walks through the door of a hospital or a facility, whatever is the right treatment for them can be the treatment that is chosen and recommended.
I'm sure you agree that the key to this is collaboration and communication. If we are at a multidisciplinary meeting and interventional oncologists are there, as they should be, there may be a bit of overlap between the disciplines, but by and large, we do the same thing by different means, and sometimes one is appropriate and sometimes the other is appropriate. Sometimes both are appropriate, in which case local experience and expertise will probably decide it. So I agree with you. I don't think there is any great competition here. I think both disciplines have a lot to gain from collaboration by expanding the spectrum of what they do.
Absolutely.
They should just talk to each other.
Absolutely.